Heyo, Patrick. How you doing, bud?
Not too bad at all, buddy. So, what did you bring me today?
We're going to be talking about dialysis and kidney health and things like that today. We have a specific request to go over this. We're covering the the NIH with Beccaria on Dad Saves America. And someone said, well, hey, there's this other thing that's costing a lot of money, and it's in the big, beautiful bill and Medicaid and Medicare.
Yeah.
So we're going to go over it. So we're going to go ahead and link the 3 articles and the 3 places that we've gotten our information and any other stuff. But I'm going to go ahead and start reading some of this, and we can compare and contrast some of the things with the United States and Ireland.
Yeah, as I said, our health system is slightly different from yours. Well, more than slightly different.
just a wee bit, sir. Just a wee bit. All right. So this is from a Mr. Paul McGee over at the National Kidney Foundation. So it is titled, "The Big Beautiful Bill is Downright Ugly for Kidney Patients." So some of these statements are from Jesse Roach, Doctor, Senior Vice President, National Kidney Foundation, on the Senate's passage of the one big, beautiful bill. So, Washington, D.C., July 1, 2025. The so-called Big Beautiful Bill that passed the Senate today is a giant leap backward for people living with kidney disease. It's deeply disappointing that the Senate took an already problematic bill from the House and made it worse. The Senate's version accelerates devastating Medicaid cuts, imposes new burdensome barriers to care, and threatens the health and lives of kidney patients. So it looks like they've raised, so it functions in 2 spaces. One is Medicare, which is the primary, and the backup for most of the kidney-related type stuff, hemodialysis, and those who have high blood pressure and require dialysis. It raises the bar. It says you are required to submit XYZ information for us to ensure that you are an individual who is in need of the service and the support.
To explain to people, what would that be in form of? Bank statements, so on, income, tax, the whole lot?
There's a ton of bullet points on this one. We're also going to be discussing changes to Medicaid. It's the next thing we're going to be going over. So all those things are going to be included. So this is just the opening volley, as they say. Right? So nearly 300,000 dialysis patients in the United States rely on Medicaid. Yet this bill imposes an 80-hour monthly work requirement, introduces new copays, and slashes key funding streams for rural hospitals and dialysis clinics. These changes could leave millions without coverage, undermining early detection, disrupting life-sustaining treatment, and forcing patients into an already overburdened emergency-only care center. Remember, we talked about that.
What does it mean by the 80-hour monthly work requirement? So you have to work a minimum of 80 hours per month in the month, is it?
I think it has to do with qualifying time. So for you to get a retirement and certain kinds of things in the United States, you have to work for, I believe it's 40 quarters, right? So 40 90-day periods, and then you get access to these benefits.
So you work roughly about 10 years. We say 10, 11 years. Okay.
Right. Yeah. Until you have investiture and you've contributed and you are part of the contributing portion. Which has
we have the same over here when it comes to contributory pensions and so on. You have to have so many working weeks before you even get considered for certain benefits.
Right. So the system is set up where you pay into it, and then later you receive the benefit of having appropriately contributed. Right. Okay.
Right.
And this is a pretty short one. We'll just go through his bullet points, and then we'll get to the next article. Some of the most concerning provisions include bullet point number 1, a work requirement. New mandates would apply to parents of teenagers and others with chronic health needs, including kidney disease, putting them at risk of losing coverage before qualifying for Medicare. So for your children to receive the benefit, you as a parent need to have contributed X amount into the kitty, right? So I, as a parent, have worked 40 plus quarters. I've contributed, and now my children can gain access to
so they worked 10 plus years within the country, paid. What happens to new arrivals into the country? You say people come over on work permits and so on. Say they worked less than that requirement. Could they qualify for something like this?
That would have to be in the bill somewhere. I have not read the entire Big Beautiful Bill. It is massive. That thing, it's huge. And I'll click over the other thing because I think it says the name of the bill. HR1.
HR1, okay.
HR1. All right. So provider tax cuts. The bill reduces allowable Medicaid provider taxes from 6% to 3.5% by 2031, limiting critical funding for dialysis clinics, particularly in rural areas. Okay. So Medicaid provider taxes means that when an employer pays into the system, they're paying 6%. So what they're trying to do is reduce that amount that goes in from the companies to reduce their contribution, so that they can reinvest that money in other places to help advance their company, as opposed to being burdened by that up to 2.5%.
That's a nice tax cut for companies, isn't it?
Well, it's a good tax cut for the companies, right? But that also means that company can employ those saved monies into strategies to forward the need of their company. I'm not saying good, bad, or other. I was thinking that before.
Sorry for laughing. Yeah.
Well,
in reality, by the way, the shareholders are going to be really happy.
Oh, for sure.
Let's say shareholders are going to be really happy with that one.
It will allow them to expand their opportunities, I'm sure. New copays,
$35. Or yachts. Get yachts.
Right. New copays, a $35 per treatment copay for dialysis and CKD patients above the poverty line could cost dialysis patients over $5,000 annually. A lot of times when you're doing dialysis, it's 3 times a week, right?
Right.
So
which is about $105 a week. So if you're getting 3 treatments,
right? So we'll say $420 a month, $420 a month, right?
Wow.
Understand that a lot of these people are living in a space where they are getting between $900 and $1,100 a month. And if their housing isn't assisted for with Section 8 housing, then that's functionally half of the income they have coming in, which could be quite a problem.
That is awful. To be honest, just reading that now, amount of pressure put on the elderly, especially, right? People on fixed incomes.
For sure.
That's not fair. That's a nasty little.
But it could be devastating. It could be by the time February rolls around, you owe so much money you can't pay your regular type bills, right?
Yeah.
So sometimes there is no more way to tighten the belt. You have no place else to go, right?
Exactly.
So ACA enrollment barriers. The bill would eliminate automatic re-enrollment and increase paperwork burdens, potentially delaying coverage for over 700,000 individuals by 2034. I don't know how they came up with that number. If it's true, that is definitely deplorable.
Yeah, but to be honest, the simple reason is that is 9 years in the future. And if you say it's 300,000 now and it's getting worse in your country, logic would say that number will be roughly around 700,000. Thinking about it, 9 years on,
Okay. Inadequate rural health funding. While it includes a $15 billion rural stabilization fund, it falls far short of what's needed to keep dialysis clinics and hospitals open in underserved areas, right?
Yeah, that'd be like the Midwest and so on.
Yeah. Well, even rural communities on the coasts, right?
Yes.
There are folks who are poor, even in the places which have a higher mean income, right?
Yeah, I'm thinking of Florida actually at the moment. When you think about it, so I remember watching a great interview from the great state from Florida at that time.
The great state of Florida. That's right. The great state. You were right.
Yeah, I keep giving the great state of Texas, but I saw people interview there as well. And some of these communities were absolutely Florida, Texas, just seeing all these rural communities.
Mm-hmm.
Wow. I mean, when I say rural, I mean these places.
Right. Well, Florida isn't really, and Texas isn't really the most rural kinds of communities. A lot of those are in the South, right? The South has the abject poverty rural type areas that when you talk about like just devastated and poor communities. So
yeah, I see them. Even the reason why I brought up Florida is especially this news report. They were showing all the beautiful what we see as Florida, the beautiful hotels and pools, and then they went and interviewed people living outside the cities, in these small little tiny hamlets is the word I could use.
Mm-hmm.
Most of them just look like trailer parks, if I was being honest.
There's a lot of that out there.
And it was just
we
crazy.
don't call them trailers anymore. We call them manufactured homes, sir. They're manufactured
Oh,
homes.
manufactured homes. Oh, that sounds nice.
Right? Right?
Yeah, that sounds nice. All right.
I live in
Wow.
Manor Acres. Oh, nice. So it's a trailer park? Yeah. All right.
Actually, that does sound nice for what you call a manufactured home residence.
There you go. A group of them. It's not a trailer park anymore. It's a group of manufactured homes. We've softened the language. So, all right.
Wow.
So, Mr. McGee's conclusion is these changes may save money on paper, but in reality, they will result in poorer outcomes, increasing suffering and higher long-term costs on taxpayers and the healthcare system. The National Kidney Foundation urges Congress to reject these harmful provisions and instead advance policies that support sustainable, equitable kidney care. So I've reached out to Mr. McGee, and he says we should be able to, in the next few weeks, interview some of the staffers over there at the National Kidney Foundation so that we can get to the bottom of what these things mean. You know, the people who are at the tip of the spear, and they have much more knowledge about what's going on. So,
but even just reading this, it's shocking.
It's shocking. Well, the next one, you think this is shocking? We've got a lot more bullet points to go.
I'm looking at the next article here right now on my screen. Wow.
All right. So here we go. The American Kidney Fund Fighting on All Fronts by Michael Lai. Changes to Medicaid, ACA, Marketplace, and SNAP signed into law. What kidney patients should know. So starts out with HR 1 recently signed into law will have a considerable impact on people living with or at risk for kidney disease, including significant changes to Medicaid, that secondary form of backup, and ACA Marketplace and SNAP. So on July 4, the president signed into law HR 1, the Budget Reconciliation Bill from Congressional Republicans, aka One Big Beautiful Bill Act, or OBBBA. The legislation includes significant changes to Medicaid, the Affordable Care Act, Obamacare. We did an episode on that. It included Mr. Pachia, and it was on Dad Saves America.
That was an interesting one, actually. That was really interesting.
Marketplaces and the Supplemental Nutrition Assistance Program, SNAP. The Nonpartisan Congressional Budget Office has estimated that over the next 10 years, the new law will result in 10 million people becoming uninsured, cut federal Medicaid funding by $990 billion, cut federal Affordable Care Act Marketplace funding by $213 billion, and cut federal SNAP funding by $280 billion. The funding cuts to Medicaid and SNAP are the largest ever cuts to the nation's safety net.
Wow.
The impact
is
dire. It's dire. Yeah, it's a lot of money not being spent out. Yes. So, but we received some comments from a couple of our videos. One of them was type 2 diabetes can be regulated with some slight medication if you have hypertension or certain kinds of kidney disease. Exercise, a little bit of medication, and appropriate diet. Right, but our food, especially in the United States, is not really the healthiest.
No, it's not. And because what a lot of people don't understand is a lot of American foods. The reason why America doesn't have much food exports other than staples like rice and potatoes and whatever else. Is most of the ingredients in your food is banned in most of the world. It's shocking the amount of heavy sugars because we use corn sugar quite a lot of corn.
The high fructose corn syrup or corn sugar or
corn sugar. We use cane sugar as such, which is a lighter sugar.
Well,
they have both the same kind of flavor profile, but one is vastly cheaper than another.
Oh, for sure.
Yeah.
I attempt to avoid high fructose corn syrup at every chance. I've even asked restaurants, "Hey, does this have high fructose corn syrup?" I don't know. Cool, bring me a coffee. I'll put some packet sugar in here if I want some sugar. You know, it's not great. And I remember when I was a kid, the first time I saw something called Red 40 on a label for what's in the thing I'm consuming, and I'm like, what's Red 40? Oh, I don't know, but it's in there, and it's significant enough that they listed it on there. So there's a lot of Red 40 in the thing. Apparently, it's a dye, and it's not good for you at all. So, all right. The impact of HR 1 on people living with or at risk for kidney disease will be considerable, considering that Medicaid is a vital part of the nation's safety net for people with low incomes and millions of people with and at risk for kidney disease rely on Medicaid for their health care. Losing health coverage means people will lose access to healthcare providers, services, and treatments that can prevent chronic kidney disease, CKD, diagnose CKD earlier and slow its progression, and manage CKD and morbidities. So comorbidities are the things that you have along with something that is unhealthy. So all of your comorbidities are all the things that are negative impact on your health. So
a lot of one disease will lead to another, a host of smaller problems, as they say. I've seen that many times, like especially with diabetes, leads to other problems as well. Like you could lose your toes. There's other issues that can happen with diabetes, not treated properly.
For sure.
You see quite a lot among the alcoholics. It's the best word I could describe it, say, in Ireland. I say a lot of us in Ireland listen right now would probably be used to diabetes among the alcoholic community, where they would start getting diabetes, then they start losing fingers and toes and so on. We're kind of more used to that scenario.
For sure.
So, wow.
100%. 45% of dialysis patients are dually eligible for Medicare and Medicaid coverages. There are different levels of Medicaid wraparound coverage for dually eligible beneficiaries, depending on the person's income. So that's a lot of words to say there is coverage that is going to be reduced, or there's going to be a higher bar for entry, right? So we're going to have to pull it out of the drawer, look at it, and see if you are actually due these dual and wraparound coverages.
No,
to see if you're an actual beneficiary of the program. Go ahead.
What I'm saying here is, see the requirement for states at 80 hours a week. Does that mean people will have to work 80 hours a week?
80 hours a month.
In order to get all these benefits?
Well, again, that's why we're going to be interviewing the staffer. But I think there's a basic level of entry. And if you haven't contributed appropriately, then you won't be available or you won't be eligible for the dual coverage.
Wow. So if a person has long-term kidney disease, say they were born with, and they're just living their lives, but unfortunately with kidney disease or diabetes, they wouldn't have the energy to work a proper, even 80 hours a month, for the most part.
So
Does that mean they would lose their benefits? I wonder.
It's possible. Like I said, that's why I want to interview the staffer. But this is a lot of basic information. Functionally, we're saying the bar is going to be raised for eligibility, right?
Yeah.
If you don't contribute at all, then you probably shouldn't be receiving the benefit from something you didn't contribute to, right? I think that's the basic gist of what I'm getting here.
Wow. And what I find shocking, I keep going back to this even here again, is the $35. Doesn't sound like much, but it's per service.
Right.
And as you were saying, if they're getting 3 services a week, and that's
right. So pull out the calculator, do 52 times 3, right? So it's 159. So 159 times 35. And that's going to be the overall base cost with a $35 copay.
That's crazy.
159 times 35.
If $105, say $100 a week, it will break down Barney style. That'll be about 5,300 roughly.
We'll do 159 times 35 equals $5,565.
Yeah, 60, yeah.
So if you're only receiving 12 to 13,000 in actual cash benefit, that's half your money. That's half your money. It's half your money for dialysis.
Pay for your rent or food or living costs of any other sort.
Right. And if you understand that exercise and diet are super important and you restrict their ability to purchase food that would be healthier, then that compounds the issue, right? Yeah,
that makes it. That's what I was about to say. This is just making a bad situation a lot worse for people.
For sure.
Unnecessarily, especially when you see a country that can spend billions and billions and billions of dollars on the defense industry,
right? Well,
but still turn around and put this cost onto their citizens. There's something definitely, as they say, rotten in the state of Texas.
Well, so also understand that 1 in 5 of our dollars spent federally is on healthcare. So if that's the case, then we are misspending somewhere. And we're actually watching a video the other day that was talking about colleges and admissions and administrative staff, where the student body is actually slightly reducing, but admin staff has gone just insane, right? So the bureaucracy that's been laid in on top of some of even our Ivy League schools, right? Just the bureaucracy is, you now have 40 deans that make X amount of dollars, right?
Well, yeah, I understand the contrast, but what I'm saying is this is an unnecessary expense to put onto people.
Oh, well, and there's other massively unnecessary expenses. Like in World War II, there were 7 4-star generals for an army that included approximately, or a military force that included approximately 12 million service members, right? So now there are 40 4-star generals, right? And each one of those 4-star generals has access to a G5, which is an airplane that is about $50 to $60 million plus expenses, right?
Wow.
So we have 40 individuals in the military who are accessing millions upon millions of dollars of assets. And we have soldiers and airmen and sailors and Marines who don't have enough money to eat.
Behind all that as well. Wow.
Yeah. So, yeah, I mean, that's not good, right? So we have 40 people who have access to millions upon millions, billions at that point, right?
Yeah.
And then we have service members who are trying to support families who don't have enough food for their kids and themselves, right?
Yeah.
So
this is, as I say, everything seems to be backwards. I don't know, it's this entire bill. On one hand, they're giving a tax cut to businesses, but then they're putting this burden on the patients.
Right. Well, also check this out. This is an interesting one. In World War II, there were 14 enlisted personnel per officer / non-commissioned officer. Now the ratio is 1 to 4. So 4 enlisted. Wow. Yeah. Yeah. So we have a lot of people with spoons in the soup and not enough soldiers to turn the spoons. You know what I'm saying?
I know recruitment numbers, like most defense forces across the G20. The recruitment numbers are down because young people just don't want to join the armed forces.
Well, in the United States, it's even worse.
Seeing what the young people are getting paid to join.
Oh yeah. Well,
you can't really blame them.
Once you get to staff NCO, it's not a bad rate of pay, right? But the problem is that over 70% of those who are of the age to join the military, for some reason, have some physical or mental malady that will disallow them to be inducted into armed services of their own volition, or even if the Selective Service institutes a draft. 3 out of 4 potential service members would be unable to even serve at that point, right?
Yes, and I think that's the more down to the people living well is the word I'm trying to find a very polite way of putting this.
Rich pensioners, maybe?
I'm talking about the young people who are overly indulgent on bad habits is the word I could use.
Right.
Which have led to very unhealthy outcomes.
Right, and a lack of appropriate social interaction as well. So, all right, let's get back to the kidney thing. We have gone quite far afield. Studies have shown that states that expanded Medicaid have better patient outcomes. Specifically, diabetes and high blood pressure are responsible or greatly contribute to 2 of the 3 new cases of kidney failure. People who live in states that expanded Medicaid and have improved blood pressure and blood glucose levels compared to those states that did not expand. Access to Medicaid resulted in lower mortality rates for the first year among people who started dialysis compared to those in states who did not expand Medicaid. More patients in states with Medicaid expansion were preemptively placed on the transplant list so they could be on dialysis for a shorter time. So that's access to someone else's kidney, right? Yeah. They get on the list sooner, and when you get on the list sooner, you can get the thing sooner.
What they're saying in a roundabout way is the more support services you have, the better the outcome. That's pretty much what they're saying.
Right.
In a lot of ways. Which makes sense, really. It's common sense.
Oh, wow. Okay, we're going to cover the Medicaid portion. The ACA Marketplace and SNAP will save for later. Just let us know if you really want us to get into the brass tacks on that one.
Yeah, we'll just stick to the kidney section, as they say. SNAP will be the SNAP program. It'll be a whole different type of episode, I think.
Right, and the ACA stuff for the Affordable Care Act is going to be pretty much just piling onto this. So Medicaid requires state to implement 80-hour a month work work reporting requirements for all Medicaid expansion individuals, 19 to 64, with some exceptions. All right, so this is you need to work, so you need to pay into benefit to get benefit. New limits on provider taxes and reduces the safe harbor threshold for states that have expanded Medicaid, effective upon enactment, but states may have up to 3 fiscal years to transition existing arrangements that do not comply. So some of our states, such as California, Illinois, New York, are going to probably use up every second of those 3 years to maintain the higher level of Medicaid support.
Yeah.
Well, here's a good one. There's no language that specifically excludes dialysis patients, but they covered that by the $5,600 it's probably going to cost them, the money which they won't have. Limits the use of state-directed payments to finance the state's share of Medicaid program, effective upon enactment. So this means if a state has expanded Medicaid, they can't just say, hey, federal government, we expanded it, pay us money. The state that enacted it is going to be required to pay for the thing they enacted.
Okay, that's
right. If you want more money, you don't just get to legislate taking more money from the federal government. You have to find the monies yourself, which is going to lead to lots of interesting tax problems. The state of California has a thing called the Mafia. Sorry, not the Mafia, the Franchise State Tax Board. And they take 13 to 14% of each Californian's paycheck. They
right. Okay.
Little Uncle Sugar takes theirs too, and you do
not
want to fight them.
California, how does other states deal with this issue?
Property taxes, state taxes, taxes on fuel, certain kind of district and county taxes for firefighting, mosquito vectors, all kinds of stuff. Certain kinds.
So pretty much every state has their own way of collecting taxes.
Well, communities too. Communities in the United States have a thing called the Melrose tax, which is when you buy your home, you are paying a Melrose tax, which goes directly to the school district, right? So,
we have something similar over here with property taxes.
Right. Well, but the funny thing is that has really empowered those teachers unions to have an inordinate amount of power because they are managing huge excesses of money, and you end up where school boards administrators, again, we're talking about this, where the school boards are paying themselves a massive paychecks. But the ones who are, again, at the tip of the spear, the teachers, are not getting better resources, more money.
So I remember us doing that episode, and I remember our producer at the time brought up some figures. And for Irish citizens, for Irish listeners, was it Buffalo, wasn't it? Buffalo School District?
Detective High, showing the corruption and the amount of money and the horrible actions by their board.
That one district brought in just shy of 150 million in 2 years.
That's quite a sum of money.
Now, bear in mind, the Buffalo School District, for people living in Ireland, is roughly the same size district, serving the same population as the county of Cork.
Yes.
Student-wise, by the way.
Yeah.
And that's how much money they brought in. And they still pay their teachers half of what our teachers are paid in my country.
Yes. Well, and our school, again, volunteer school boards in Ireland versus paid positions with Melrose taxes and other ways to finagle money from the populace, right?
Yeah, but the money was crazy, absolutely crazy money.
Yeah, it's insane.
Wow.
All right. Establishes a $50 billion rural health grant program for states between fiscal year 2026 and 2030 to be used for payments to rural health facilities, effective upon enactment, but funding is first available January 1st, 2026. So that's coming up pretty quick, right?
Right, yeah. That's coming, very, very, wow.
All right, and here's the one we read earlier. Requires states to impose cost sharing of up to $35 per service on expansion adults with incomes 100% to 138% of federal poverty level. Okay, so if you're making the FPL or federal poverty level, then you'll be expected to pay the $35. This isn't for those who are making the $900 to $1,100 a month. This is for those who are at or slightly above threshold for the poverty level. It exempts primary care, mental health, and substance abuse disorder services, as well as services provided by federally qualified health centers, behavioral health clinics, and rural health clinics. Effective October the 1st, 2028.
Okay. So, wow. What is the federal poverty level, just out of curiosity?
Well,
for people listening.
I think right now it's at about 29,000 a year. But if you could look that up, I will read on the next one.
That's what I'm Googling right now. It is $32,150.
So
the federal poverty level.
That to about 35 or 36,000. If you make that much per year, then you'll be expected to spend over $5,000 of your money if you require dialysis, right? But a lot of people on dialysis. So dialysis takes 3 to 4 hours a shot.
Oh, wait a second. Oh, by the way, I was just waiting for Google to finish loading on my end.
Okay.
So that is a poverty level for New York State. Well, every state has a different poverty level. Okay.
But there's a
why can't you all have a standardized thing?
Well, there's a federal poverty level. There's a federal one. And that 32,000 sounds about right.
I just clicked on your US government website. It's way better, actually. By the way, do not use Google AI. It's useless. So I clicked on the normal your government website. So the federal poverty level of 2025 stated by your government is a household size one person is $15,650 a year. According to the US, to the central federal government.
Yeah. Try and rent a room, have a car and a phone and all those things and insurance at $15,000 a year. Yeah, it's not happening.
No, it's not happening.
Not happening at all. All right. Require states to conduct eligibility redetermination at least every 6 months for Medicaid expansion adults. Ooh, that's high frequency. Limits retroactive coverage in Medicaid from 3 months to all enrollees to 1 month for Medicaid expansion enrollees for 2 months for traditional Medicaid enrollees. So that's going to require more people to manage all that. And that's effective January 1, 2027. Require states to obtain contact information on all Medicaid enrollees. Oh, that's actually good. And review the master death file at least quarterly to determine if any enrolled individuals are deceased. And they're doing that because a lot of people who are deceased are still getting benefits. People who are over 200 years old, people who haven't been born yet.
Yeah, I remember Musk brought that up.
Yes, he did. He actually brought it up on
By the way, when people looked into his figures, it wasn't as extreme as he made it out to be. I put that with you. He might have added an extra zero here or there, but it was bad, but not as bad as he was saying it was compared to other countries.
Eliminates temporary financial incentive that was created in the American Rescue Plan Act of 2021 for non-expansion states to expand Medicaid, which would give them a 2-year 5% increase to their federal matching funds for their traditional Medicaid population. So what this did is it allowed states to literally expand 5% and force the federal government to pay another 5% on top. So a state with Wyoming with about 1 million residents, not too bad. But when you get to places like California that have 40 million people, 5% is a massive, massive figure.
Well, right? I understand compared to each government, but the problem, I think this will genuinely affect millions of Americans. Not now, but in the future.
Oh, yeah.
This comes into effect.
So prohibits the secretary. Go ahead.
It's an absolutely nasty, unnecessary cut. And I understand why they're doing it, because your population getting older or more unhealthy. You have to get cost savings from somewhere. But the fact that they're taking it directly from people's pockets like this is a very unnecessary cut. That's my own personal opinion, by the way.
Well, plus we have a lot of jobs that are going away from manufacturing. AI is taking over a lot of these functions that you would have a secretary for. It just seems that there was a lot of jobs that were created in the 40s, 50s, and 60s that have sustained until the 2020s, but now they're no longer required. So now it's going to be even more difficult to find a job unless you have some niche specialty and something that AI can't do or a robot can't do in a factory, right? So it's kind of rough. It's kind of rough.
It's rough out there for young people. We've seen that before in the news.
For sure. So prohibits the Secretary of HHS from implementing, administering, or enforcing certain provisions from the CMS eligibility and enrollment final rule of October the 1st. Enrollment final rule until October 1, 2034. This rule would have streamlined the Medicaid application process to make it easier for people to enroll and retain Medicaid and CHIP coverage, effective upon enactment. Okay, so this is going to just make things more difficult for people to try and get into this.
Yes.
Remember, Elon Musk was talking about a lot of the issues we're having is our structures are bad, right? So the computers that we use, the things that we have access to, just all of the work that's done behind the scenes, which could be done on more efficient systems, are literally just on less efficient systems.
I think I remember Musk bring that up, and the prime example I think most American audience remember is just before lockdown, when millions of Americans tried to access Social Security, to sign on with different forms of social welfare or welfare over in America, and all across the United States, all the systems was crashed.
Oh, yep.
State systems have crashed left, right, and center.
Boom, done. 100%. Yeah. Mm-hmm.
And one lady, I never forget her. She was being interviewed. And she was laughing. Just on the state of Texas, there was less than 100 people managing the whole Social Security system for that state.
Yep.
Physical people.
Yeah, well, I think the population of Texas is about 26 million. I mean, it's significant.
Yeah. Well, I put this way to you. That's roughly the same size, roughly. We'll take the UK. That another 10 million. Yeah. Say a small bit less than the UK.
I think the UK right now is about 62 million, 63 million.
62 million. So I think they would have a bit more than 100 people over there managing that whole Social Security system.
For sure. It's like when people make comparisons.
That's one of those little things that kind of, not picking on Texas, by the way.
Right.
We like to visit your state sometime. But just say that you might need a bit more staff.
Oh, yeah, for sure. I've lived there. It's a beautiful place. The weather is insane. Yeah. But so, and you take populations of countries, like we'll say the UK is 62 million, Canada's 40 million, Ireland's 5-6 million. We have states that exceed that. New York State, the state of Florida, right? So when people say, well, the entire country of Canada X, well, they have 40 million people in Canada. California has 40 million people, right? Texas at 26, Florida at 29. Like, our states have as much population as do these other countries, and we're trying to manage them under a federal net, right?
A federal umbrella, as they say, which is
it's going to present some issues because each state's going to want to do the things they want to do the things, right? So
because every state has its own different personality as well, you could say.
Oh, for sure.
Like every country, it's like the EU. Every country is different in the EU, even though we're under one banner. We all do things slightly differently. Yeah.
We're watching. Was it Reggie Lynch from What If All Tist? He was saying, look, people in California are wildly different than Texans, who are wildly different than those from Alabama. But those from Ireland have more in common with those from the UK than does a Californian with someone from Iowa. Wildly different, right? Like their expectations, what they need, want, desire, their culture, and all that stuff. So we're managing a bunch of little fiefdoms that want to do their own thing, but they're still under federal supremacy.
It'd be like I think a better analogy, say, for Europe, I'm just using the European Union. Mm-hmm. It'd be comparing our culture to French,
right,
or the French to Spanish, or so on. Even though we're under the one flag, we all operate completely differently.
Correct. All right,
and that's probably the best analogy for the European Union.
Restricts Medicaid or CHIP eligibility to U.S. citizens, and nationals, lawful permanent residents, certain Cuban and Haitian immigrants, citizens of the freely associated states lawfully residing in the United States, except that CHIP funding may still be used for expenditures for health services initiatives under the Plan for Improving the Health of Children, October 1, 2026. This bill excludes many other lawfully present individuals from Medicaid eligibility, including individuals granted asylum, as well as those admitted as refugees and survivors of trafficking, domestic violence, and other serious crimes. So if you emigrate because there was horrificness in your place, not the place itself, but your specific area, right? Say some city in El Salvador has something horrible and you manage to make the United States and say, look, the city in which I live has this. I need some benefits, They're going to be like, no, you don't get them. You're not from here. You didn't contribute, so then you get nothing, right? So requires HHS to reduce federal financial participation to states for identified improper payments errors related to payments made for ineligible individuals and overpayments made for eligible individuals where insufficient information is available to confirm eligibility. So if a state just says, hey, give me some money because we gave people some money, they're going to say, I need the receipts, bro. Like, I need receipts. And if you pay them improperly, you, the state of whatever, Nevada, Washington, Texas, Iowa, Connecticut, whatever state you're from, if you didn't appropriately regulate it, then you pay it because you didn't do it correctly.
But do you think this is like millions of Americans are going to be cut off? This is the way this bill is being laid out. How do you think this is going to affect future primaries and so on?
It depends on if the voting is American citizen voting or if the representation of those non-citizens in Congress and the Senate pull a lot more weight. Because it feels like the people in the United States who are citizens are saying, we want a thing and we want to stop expending money. But the problem is it's going to hurt them in the process. There's going to be sacrifice. And I don't know that the American people are ready.
Do American people realize when they say something like that it is directly going to affect their pockets in the future? Or are they just reacting to what the talking points they see on the news?
The assumption is that the taxes paid are going to be used more efficiently. So if they don't see a significant raise in their taxes and things get better and those who are non-citizens stop receiving the benefit, which is functionally what they want, we don't want people to come here and steal our resources, right? So don't come here without contributing and take our things unless you have a very legitimate reason to be here. And if the state decides they want to overpay or pay the wrong people, then those states individually will be responsible and they cannot bill the federal government for the thing. Okay. That's what they're looking for.
What I'm trying to get to is this eventually will hit nearly all Americans in their pocket eventually. Will they then realize that it's too late to put the genie back in the bottle? Because this will affect every single American, no matter what way you dress it up in Congress.
Well, for sure.
This will directly affect our pockets. But do you think most people don't realize that? Or are they just parroting what they see on Fox News and so on?
I think they just wanted to get better and they don't know the right answer. And in not knowing the right answer, they're going to try and make some kinds of changes. And some of them will be good and some of them will be bad. And then there are things that work and things that don't work. But a lot of what's happening here is the federal government wants to put the burden on the state to provide the appropriate resources because it's managed at a state level.
Right. Okay.
So there's federal government function, right? But then there are things when states expand Medicaid and those kinds of things, because there's matching monies from the federal government, right? So if I expand a service, I get money from the Fed. And it's like it says in this article here, it goes up 5% across the board. That's not 0 to 5%. That's whatever percentage plus 5% for that state, right?
But do you think this will directly affect the Republican chances later on? Because the poorer state, a lot of the poorer states are deeply Republican states. And this cut to Medicaid will directly affect their people.
I think if a large enough percentage of them get jammed up by this, they'll be very, very unhappy for sure.
Yeah.
Right.
Or will they be just told, just suck it up, Buttercup, for the good of the country?
I don't think that's going to go over very well.
Yeah.
It's when you affect somebody's draw. When you affect somebody's draw, they don't want to hear it. They just don't want to hear it.
Yeah.
So
yeah. Well, I think this is one of those few cuts that will really affect future election.
Yeah, I think it has a lot of.
I just have that feeling. I think this is one of those part of this big bill.
Yes.
One of many cuts in this big bill that will directly affect Republicans in the primaries in the future.
All right, so real quick, I want to take a look at this Irish Kidney Association. We're going to put the link in here. Yep, IKA.IE, and they're going to want you to give a little bit of items, things, monies.
By the way, our kidney, the way we do it, the Irish Kidney Association is one of our charities over here. So we handle the health with kidney disease slightly different over in my neck of the woods. So the HSE pays for your dialysis and travel and so on. But what the Irish Kidney Association does, it helps support people, getting through the process of, filling forms and going through all that. And they also help, say, if people genuinely can't drive themselves, they have volunteer drivers who come and help people out that way.
Sure. All right, so they didn't reach out to us. We didn't reach out to them, but this is a worthy cause, so I'm going to read about their impact. I want you guys to listen. So our impact. The Irish Kidney Association is dedicated to transforming the lives of kidney patients and those at risk of kidney disease through a range of impactful services. Our advocacy effort have successfully influenced healthcare policies, such as prioritizing kidney and transplant patients in the COVID-19 vaccine rollout. We champion organ donor awareness, reaching millions and engaging thousands through our annual campaign. Our patient accommodation has supported over 1,000 individuals visiting hospitals for transplants. We provide extensive counseling, a Living Well program, and a peer support service to meeting rising demands for mental health services. Additionally, our patient holidays and dialysis abroad programs offer much needed respite in support of hundreds of individuals and families annually. Financial assistance through our patient support fund also aid those in need. So, IKA.IE, go make a difference, do what you can.
Yeah.
And yeah. So I think that's
by the way, our government doesn't charge 35 euros a treatment either. Just saying.
Listen to this guy. You got anything else for him, Patrick?
Yeah, so if you have kidney disease, you're always more than welcome to immigrate to Ireland.
Sure. I'll try not to get sick to go enjoy a Guinness, but I think I'll just fly over and have a beer with you at the pub anyway. All right.
Yeah.
For Patrick McCallum, I am Alex Johansen. Ring the bell, like the like, subscribe, help us beat the algorithm, and we are out.